we decided to take action and do something to acknowledge this medical pioneer who died 125 years ago.
The first black female doctor in American history laid forgotten while almost nobody knew her name.
I was told that people come looking for her, but she doesn't have her gravestone.
She was buried in an unmarked grave for 125 years. Medical students never learned about her. Historians skipped over her, and even people walking past her grave every day had no idea who was buried there. This is how America forgot the woman who changed medicine forever, and the forgetting was not an accident. Her name was Dr. Rebecca Lee Crumpler, and if you have never heard of her, you are seeing the exact problem we need to talk about.
So for her to do that, I just think it's a remarkable story, and she overcame all that. She survived and thrived.
She was a pioneer.
Absolutely.
Rebecca Davis was born free in Delaware in 1831. But freedom in America meant very little when slavery still controlled the country. Her parents could not raise her for reasons history never recorded, so she went to live with her aunt in a small Pennsylvania town. Her aunt was the person everyone turned to when someone got sick. The aunt had no medical degree and no fancy hospital. She was just a woman who knew how to ease a fever, bind a wound, and calm a terrified mother holding a dying child. Rebecca followed her aunt from house to house and watched her save lives with nothing but knowledge, care, and determination. Those early visits planted something in Rebecca that grew into a life refusing to accept the limits society tried to force on her. By 1852, Rebecca had moved to Massachusetts and started working as a nurse in Charlestown, near Boston. The first official nursing school would not open until 1873, so nursing was an informal apprenticeship where you learned by doing. Rebecca was exceptional at it. After nearly a decade of working alongside physicians, the doctors themselves started encouraging her to apply to medical school. Consider how wild that was in the 1850s. Most medical schools would not let women in at all, and black people had no chance. The idea that a black woman could become a doctor was considered impossible. Rebecca married Wyatt Lee in 1852, a man who had escaped slavery in Virginia. Wyatt died of tuberculosis in 1863, right in the middle of Rebecca's medical training. She was left grieving, studying, and trying to survive while the Civil War tore the country apart. Most people would have quit. Rebecca pressed on. She had been admitted to the New England Female Medical College in Boston in 1860, one of only 2 schools in America that would accept women students. She was the only black woman there. For 3 years, she studied 30 hours a week of classroom instruction and completed a 2-year apprenticeship. She wrote a thesis and defended it in oral examinations while dealing with faculty who were not sure she belonged there. Some tried to prevent her from graduating because they claimed she was learning too slowly. Rebecca had advocates who were abolitionist patrons of the school. Doctors who had worked with her knew her skills and pushed back against the resistance. On March 1, 1864, right in the middle of the Civil War, the school's Board of Trustees officially named Rebecca Lee a Doctress of Medicine. She was 33 years old and became the first African-American woman in United States history to earn a medical degree. The world barely noticed. Just a brief mention in a Boston newspaper about a colored graduate appeared, almost an afterthought. After graduation, Dr. Rebecca Lee went south to Richmond, Virginia, the former capital of the Confederacy. The year was 1865. The Civil War had just ended, and 4 million people had just been freed from slavery. They were dying from disease, starvation, and conditions that white doctors refused to treat because they simply would not care for black patients. Rebecca began working with the Freedmen's Bureau, treating over 30,000 black residents in Richmond. She cared for women giving birth, children with fevers, and families who had never seen a doctor in their entire lives. She worked from dawn to dusk 7 days a week and treated everyone for free because most of them had nothing. The racism Rebecca faced had material, deadly consequences. White pharmacists refused to fill her prescriptions. They looked at her handwriting, saw it came from a black woman, and just said no. Patients died because of this. White physicians would not consult with her. They ignored her medical observations even when she was clearly right. Hospital administrators denied her admission privileges. She could not admit patients to hospitals because of her skin color. This was a deliberate strategy. White practitioners denied access to pharmacies, hospitals, and professional networks to make it nearly impossible for black physicians to practice effectively. The system was designed to fail her and to prove that black women could not be doctors even when they clearly already were. Rebecca married Arthur Crumpler in 1865 while working in Richmond. Arthur had escaped slavery, served with the Union Army, and learned to read and write later in life. He was still taking classes at age 74. They had a daughter together named Lizzie Sinclair Crumpler, though historians believe she may have died in infancy. The records are sparse. After her years in Richmond, Rebecca returned to Boston and set up practice in Beacon Hill, a primarily black neighborhood at the time. She saw patients in and around her home on Joy Street and treated people regardless of whether they could pay. The discrimination followed her back north. Pharmacists still refused her prescriptions. Other doctors still dismissed her. Hospitals still denied her privileges. By 1880, Rebecca had mostly retired from active practice. She and Arthur moved to Hyde Park, but Rebecca recognized something crucial. The medical knowledge she had spent decades accumulating needed to be shared with the people who needed it most: mothers, nurses, and women caring for children with no access to physicians. In 1883, she published a book of medical discourses in 2 parts. Consider what it meant for a black woman to publish a medical book in 1883. The medical profession was consolidating its authority through journals, hospitals, and professional associations. Black practitioners were almost entirely excluded from those channels, and women were barely entering medicine at all. Rebecca's book recorded clinical observations at a time when mainstream medical journals would not publish black authors. It offered practical tools for caregivers living beyond the reach of professional medicine. The book focused on women's and children's health. Part 1 covered diseases of infants and children, while Part 2 covered medical and surgical treatment of women. Her writing emphasized prevention, nutrition, careful fever management, and simple hygiene. Her main message centered on the possibilities of prevention. She believed thousands of children died every year from diseases that could have been prevented with timely care and basic knowledge. Rebecca understood that socioeconomic conditions cause disease. Poor living conditions, lack of shelter, and inadequate nutrition were not just unfortunate circumstances. They were medical crises. This understanding was radical. White officials blamed high death rates in black communities on supposed racial inferiority, but Rebecca pointed to structural causes like poverty, displacement, and lack of access to care. She was addressing what we now call social determinants of health in 1883, about 40 years before the concept would be formally articulated. Rebecca Lee Crumpler died on March 9, 1895 in Hyde Park, Massachusetts. She was 64 years old. For more than a century, her grave and her husband's grave remained unmarked. No headstone existed. No memorial stood. People walked past those graves for 125 years without knowing. For decades, history books credited Rebecca Cole as the first black woman physician. Cole graduated in 1867, 3 years after Crumpler. The mistake persisted until the late 1940s when careful scholarship finally corrected the record. But even then, Rebecca's name remained obscure. Medical students did not learn about her. History textbooks skipped her. The institutions that should have celebrated her accomplishments simply forgot she existed. This was archival invisibility, the result of institutions like hospitals, medical schools, publishers, and scholarly journals failing to center the lives of people who worked at the margins. Another reason Rebecca was erased relates to the kind of medicine she practiced, which was devalued. In the 19th century, prestige medicine focused on hospital wards, laboratories, and professional journals. The work of domestic nursing, community midwifery, and translating medical knowledge for regular people was dismissed as too local and too bound up with women's lived experience to be considered truly scientific. Rebecca's work sought to democratize medical knowledge and honor the experiential wisdom of mothers. To the guardians of institutional medicine, that democratization looked like a threat. To the communities she served, it was liberation. Only in the 21st century did people start fighting to recover her story. Dr. Yvonne Thornton McLeod, a black female physician who graduated from Boston University in 1981, never learned about Crumpler in medical school. She discovered her later and made it her mission to get Rebecca the recognition she deserved. In 2013, McLeod convinced Boston University to create a permanent exhibition about Crumpler. In 2019, Virginia Governor Ralph Northam declared March 30th, National Doctors Day, as Dr. Rebecca Lee Crumpler Day in Virginia. Boston University established the Rebecca Lee Crumpler Scholarship Fund to support Black women aspiring to become physicians. Finally, in July 2020, 125 years after her death, a ceremony was held at Fairview Cemetery. Local historians, physicians, and community groups had raised funds to place headstones on Rebecca and Arthur's graves. The granite stone reads, "The community and the Commonwealth's 4 medical schools honor Dr. Rebecca Crumpler for her ceaseless courage, pioneering achievements, and historic legacy as a physician, author, nurse, missionary, and advocate for health equity and social justice." Rebecca Lee Crumpler matters today because her life demonstrates that medical practice has always been political. Providing care in a racist, unequal society requires moral imagination, logistical creativity, and the courage to persist when every system is designed to make you fail. Her work with the Freedmen's Bureau shows that healthcare during Reconstruction was about rebuilding bodies and social possibilities in the wake of slavery. Her book anticipated themes that remain central in public health today. The importance of maternal and child health, the role of education and prevention, and the need for information accessible to people outside the professional class all appear in her work. Her insistence that knowledge should travel into homes and communities is a lesson for anyone trying to close gaps in healthcare access and literacy today. Her story forces us to interrogate who writes medical history, who gets included in the canon, and whose achievements are celebrated while others are forgotten. The processes that erased Rebecca for over a century are still operating today. Recovering Crumpler's story honors a different model of medical authority.
She was able to not only serve within that venue from her clinical practice, but also by offering things to the community through her writings to promote health education and medical education.
She balanced attentive bedside care, community knowledge, moral seriousness, and careful observation. That mode of practice sits at the intersection of clinical skill and civic responsibility. In communities where hospitals are distant and resources are limited, Crumpler's work remains a model for building practical, humane systems of care. She did everything right. She got the education, earned the degree, and practiced medicine with skill and compassion. She published groundbreaking work, served the most vulnerable populations, and saved lives. America still tried to erase her. That erasure tells us something crucial about how history works. It is not neutral. It is about deciding whose stories matter, whose achievements count, and whose lives deserve to be remembered. For 125 years, America decided Rebecca Lee Crumpler's life did not deserve remembering. That decision required institutions to look at her achievements and choose silence. It required historians to write medical history while deliberately excluding her. It required educators to teach students about medical pioneers while skipping the first Black woman doctor. Every time someone wrote a textbook without mentioning her, that was a choice. Every time a medical school taught history without including her, that was a choice. Every year that her grave went unmarked was a choice. Those choices were part of a pattern that says some lives matter more than others. Some achievements are worth celebrating while others can be forgotten. Some people deserve monuments while others get buried without a name. Today, only about 2% of practicing physicians in America are Black women. The barriers Rebecca faced, including discrimination, exclusion, and devaluation of their work, are barriers that Black women doctors still face in different forms today. When Rebecca walked into that medical school in 1860, she was the only Black woman there. When she graduated in 1864, she was still the only one. When the school closed in 1873, it had never graduated another Black woman. Rebecca's life reminds us that the labor of care has always been a political act. Healing is inseparable from the social conditions producing sickness in the first place. Courage can look ordinary, like a woman making house calls and writing prescriptions that pharmacists refuse to fill, and still be revolutionary. Rebecca Lee Crumpler was not an anomaly. She was a harbinger, a figure whose vision of medicine as care, education, and social responsibility remains urgently relevant. She showed that professional accomplishments gain their deepest meaning when they serve people who might otherwise be forgotten. To recover her story is to insist that medical history must include all the hands that have sustained health in America. History has a habit of flattening complicated lives into dates and achievements. Rebecca was born February 8, 1831. Her MD was conferred March 1, 1864. She published her book in 1883 and died March 9, 1895. The fuller story is in how she moved through social worlds and made marginal medicine matter. She reminds us that the people who change the world do not always get credit while they are alive. Sometimes they do not get credit for over a century, but that does not make their work any less important. It just makes our forgetting more shameful. Next time someone tells you about the first to do something, ask who got erased from that story. Ask whose achievements were overlooked and why we remember some pioneers and forget others. When you hear about diversity initiatives and representation in medicine, remember that Rebecca was doing this work in 1864. The fact that we still need these conversations 160 years later tells you exactly how hard institutions fight to maintain the status quo. The question is what we are going to do about it. Recovering one name, placing one headstone, and creating one scholarship is a start, but it is not enough. The systems that erased Rebecca are still operating, still deciding whose stories matter, and still leaving brilliant, courageous, revolutionary people buried in unmarked graves while less deserving figures get monuments.